Hello， 大家好，歡迎大家收睇今晚嘅公民有計傾。咁今日咧，我哋會講都係澳門嘅抗疫工作，同埋咧究竟點樣可以咧開展下一步。即係我哋大家都知道抗疫少少疲勞啦，咁都想經濟會開放啦，好啲啦，咁全球可以重新係喐過嘅。咁即係點樣先做得到咧？咁今日咧好高興咧，就因為我哋知道阿 Jackie 啦，係啊，張耀豪咧，咁佢咧就係之前我哋嘅病毒學博士，我哋都係咁叫佢嘅。咁其實佢而家已經喺上海嗰度咧就做一個教研嘅工作，做咗一段時間咁樣。咁今次咁啱佢翻嚟澳門咧，咁好高興就請到佢。咁啊仲有咧，咁佢就幫我哋咧請埋一位世衛專家 Prof Zisis 咧，就過嚟今晚同我哋一齊探討幾個問題㗎。咁大家睇到之前個廣告啦，我哋都會先講下澳門嘅成個抗疫工作係點啦。下一步我哋要慢慢走出去，或者即係同個世界相連翻，其實有啲咩要做咧？咁呢個就一定要講到全球而家個疫苗護照其實係咪可行嘅？同埋即係今日即係好高興請到係我哋叫呢個學科嘅專家啦。咁我哋梗係想都聽下，即係其實而家喺我哋叫做學界啦、學術界，咁包括阿 Jackie 啦，咁佢所在嘅都係一個公共衛生嘅學院啦，係呢一個上海。咁即係佢哋自己又點睇咧？咁同埋我哋都今日請到 Prof Zisis 咧，都想請佢同我哋講下，即係其實而家喺包括一個叫國際層面啦、世衛咧，佢哋點樣睇？因為呢幾日叫講緊即係印度啦，就引起大家擔心第三波嘅新冠肺炎疫情嘅爆發，咁會唔會有即係沒完沒了咧？係有咩出路咧？點咧？咁樣好，咁我哋今日就好高興咧，就請到 Jackie 翻嚟幫手。咁仲有咧，我哋有 Prof Zisis 咧，佢已經係在線嘅啦，咁樣。咁所以或者我哋先解釋下咧，即係點解今日我哋要請 Prof Zisis 過嚟啦？咁因為 Jackie 就同 Prof Zisis 就好熟嘅咁樣，咁即係其實佢之前咧就知道 Prof Zisis 咧就喺即係今次我哋講緊係新冠肺炎呢個 COVID-19 咧，咁其實係講緊係2年前爆發啦。咁但係如果大家知道之前有嘅相類嘅一啲疫情，冇咁大規模全球爆過嘅，咁都仲有其他咁樣，咁就 Prof Zisis 都有參與過呢啲工作，或者 Jackie 介紹下先好嗎？
係啊，其實咧我同Prof Zisis 咧嘅關係係我以前喺英國讀書嘅時候咧，其實我係喺傳病系入邊嘅，咁其實係 supervisor。本身我哋兩個背景都係傳病出身嘅，咁但係後期就去咗世衛工作咧。其實世衛係一個好大機構啦，咁佢係一個叫做國際癌症機構，其實我哋簡稱叫 IRC 入邊嘅。咁其實佢係世衛嘅一個 in-house 嘅實驗室嚟嘅。咁其實世衛做任何嘅政策咧，佢都係根據科學數據而制定。咁呢個 in-house 嘅實驗室咧，就係去產生一啲科學數據，咁例如好似我哋一啲嘅致癌物啊，譬如好似吸煙危害健康呢個口號點出嚟，或者佢哋得出嘅定論咧，都係透過呢個機構出嚟嘅。咁除咗係做癌症嘅研究之外咧，因為其實我哋做任何研究都要啲生物樣本㗎嘛。咁其實Zisis 咧，佢係掌管全即係世衛所有700萬個樣本，包括一啲傳染病嘅樣本嘅。咁所以基本上係一個資源共享咯，咁佢喺世衛嘅技術部門就係管理全球嘅實驗室同埋樣本庫嘅。係啦，咁就應該係叫呢個世界衛生組織，佢係呢個國際研究機構生物樣本庫及實驗室嘅主管。咁佢之前都係有參與過，即係包括我哋講緊伊波拉病毒啦，係咪？即係同埋嗰陣時有一個中東嘅係咪叫咩什麼嘅 ？MERS 咯，我哋嘅 MERS 都係冠狀病毒。
係啊，都係一個冠狀病毒嗰個疫情嘅咁樣。咁即係當時即係 Prof Zisis 佢有參與過呢啲工作。咁所以我哋今日就都佢當然都有留意即係全球嘅疫情啦。今次咁所以我哋就好高興就請到佢過嚟咧，就同我哋講下即係佢都點樣睇澳門呢邊嘅情況嘅。咁我諗Prof Zisis 就已經在線㗎啦咁樣。咁咧我哋就睇下係咪可以咧就請到佢先咁樣咯，咁就我哋而家咧就睇一睇係咪 Prof Zisis 已經在線喎，咁樣好咁樣。Hello Prof Zisis。Hello, how are you? Okay, we want to say hi to you from Macau here. Okay.
Thank you. Hello.
Okay, thank you for joining us.
You're welcome. You're very welcome.
Okay, so actually our first question today would be like because we're coming from Macau, of course we want to know that from the international perspective, how would you comment on Macau's kind of COVID-19, the pandemic work, the related work like the border control and also the control of the whole situation? How will you comment about that?
The first thing I have to say is congratulations, because Macau is a global example of how to do things correctly. It's not just the case that Macau is a little island in the middle of the ocean. Macau is a very, very well-connected place. So in terms of risk, it's very high up. And you've managed not just to control the risk, but to control even the sporadic outbreaks when they've come, and then remain with 0 cases for a very long time. So I know a lot of public health professionals are very humble, but I think in the case of Macau, there is a very big round of congratulations that need to be said.
Thank you very much. I think we will be very happy to hear your comment now. Yeah. 咁 Professor Zisis 就講咗啦，咁其實即係覺得澳門就恭喜我哋啦，就成個嗰個疫情個控制工作都做得好好，咁亦都係即係特別有提到我哋就冇一個嗰個社區感染嗰個個案啦，咁亦都好多謝。咁但係我哋今日即係Jackie 咪都覺得。都仲有啲嘢可以再問一問。唔係，
其實佢啱啱講就係其實澳門都唔係一個冇風險，我哋一個非常之高風險，因為我哋嗰啲人流啊各方面都係好，我哋唔係一個孤島，所以我哋所以冇案例。
我哋同全世界都連結緊嘅。
係啦，咁所以咧，我哋係即係其實做佢係所以佢咁樣恭喜我哋咯。所以其實如果係有啲咩問題，我諗係我哋有啲乜嘢可以未來做得更好，因為我哋而家面對嘅可能係新冠啦。咁其實個潮流係點走，我哋有啲乜嘢可以做得更，或者國際上有啲咩走得再前啲嘅咧？咁可能我哋可以問下佢，因為佢經驗比較多咯。Maybe Zisis, we understand there are a lot of innovative ways in the international community in public health control. So, do you think what we can do to enhance or strengthen our public health control regarding to your previous experience?
Yes, I think given the amount of transmission in the rest of the world, the risk will continue to remain substantial for a period of time. So there always needs to be a need of monitoring. So the monitoring and the surveillance needs to be very active for a period, for a considerable period of time. I would say definitely until the end of the current year. But monitoring by itself, just doing monitoring alone, is not a solution. It has to be integrated with the other public health responses and also with the community responses. So if you see something in the community, then you know how to inform the people in a way that it doesn't cause panic, but calmly they understand what are the next steps. So I would say more than monitoring, you need collaboration of a lot of different departments, because it's not a case if a symptomatic patient will come. It's more a case of when will a symptomatic patient come at the port of entry, what do we do then? And how do we let the right people know about it?
咁其實佢都提到咧，即係我哋而家雖然係即係冇案例啦，咁但係其實喺因為喺澳門出邊嘅情況咧，都係非常之唔穩定，咁所以我哋只可以透過一個監察，要非常主動去監察咧，去知道出邊有咩事。咁但係淨係透過監察唔得嘅喎，咁其實我哋咧要揾一個 solution 出嚟嘅。咁呢個 solution 就係同我哋嘅社區咧要建立一個好良好嘅溝通。咁啲公眾咧佢要知道出邊發生緊咩事，
跟住又唔怕驚，
又唔怕驚，唔會嚇親人哋。但係咧亦都要知道佢哋需要做啲咩。咁俾人感覺上我哋係連接得好好嘅。咁呢個係最重要咯。即係我哋譬如有啲咩事嘅時候，我哋採取啲咩反應。咁呢個係好重要咯。其實都係講緊同社區嘅連接。係啊，
咁所以其實呢個都係講緊，因為我哋諗澳門啦，咁我哋都即係澳門人，我哋自己都讚我哋嗰個抗疫都做得好。咁但係即係而家已經抗疫咗個年幾啦，咁都好想 即係咪可以慢慢有啲開放咧？譬如我哋講緊嘛，即係有啲喺海外嘅澳門朋友翻唔到嚟啊等等，咁呢啲可以點做咧？咁我都想聽下，即係如果我哋要緩慢地有少少開放性嘅話，其實仲可以點做？同埋都要問下，即係國際嗰個疫情係點咁，或者我哋都繼續問啊 Professor Zisis。Hi Professor Zisis, so thank you for your comment. I think that we were just talking about that. Okay, people here in Macau that. Yeah, thank you for your comment. So we kind of know, and we also can recognize that government is doing a good job in handling the whole situation. But at the same time, more and more people are worrying that if we keep the border closed, okay, so we are like. Now I think we only open the border with mainland China only, but in the past we have a lot of like you said that we are very well connected, and so we want to start to connect with the world again. So you just mentioned that we need to develop a kind of mechanism to let the community understand the situation. But so that might be one point. But how about the other side? So is that vaccine passport is still possible? Is that people believe that after you take the vaccine, after the 2 doses, and then would that be really a good direction for us to, adopt the approach to start to do that, and so allow people to, start to commute between different cities now?
That's a very good question, and I think we don't have all the answers for this question at the moment. What we can definitely say, not just from an economic perspective, but from an economic, a social perspective, just a normal basic need of the population, we cannot be closing the borders for a very long time.
Yeah.
I think the people altogether have done very well to be able to adapt to the situation, but this is not a long-term situation. So we have to find solutions to open up again. At the moment, what is happening in Europe, you see entire communities that become COVID-free, and I put it in
COVID-free.
Yes, and what this means is that the entire population from the age of 18 and above has been vaccinated.
Oh.
Of course, COVID can come into these communities from another person, but it means that it will not be transmitted to many people, and if it gets transmitted, those people that get infected from the community are unlikely to need to go to the hospital. So at the moment, this is being tested in Europe in a number of small communities, island communities, because they need to open for tourism. And they need to know what is the impact of tourists into these small communities where the healthcare support is actually very difficult to get there in time. So this is one approach, that you go by community, and then the responsibility is on the community to ensure that everybody is vaccinated. There is another approach that says you can allow people to decide if they want to be vaccinated or not, but then there are some aspects of daily life that will be only open to people that are vaccinated. So for example, if you want to travel, then you need to be vaccinated. If you want to take the high-speed rail, you need to be vaccinated. So these are the two approaches that we're taking at the moment internationally to see which one is the more effective one in the longer term.
係啊，咁佢都講到咧，就係有兩個而家兩個 approach 咯，係咯。第一個就係將個責任交咗喺個社區嗰度咯，係因為嗰啲社區佢嗰個條件相對可能冇咁多，佢哋好需要啲遊客入嚟啊，或者佢哋一個島，咁佢哋啲本身嗰啲醫療設施又唔係咁足啦，咁所以可能如果佢哋 vaccinate 曬，佢哋就可以開翻你個經濟可以復甦翻咯。咁另外一個就係而家香港做緊㗎啦，即係你唔帶疫苗你個餐廳就唔可以開咁啦。咁而家呢兩個 approach 都試緊咯。
所以其實 即係我哋講話唔同地方都係其實最主要都係嗰個叫疫苗護照咧，而家都係行緊一種，其實即係唔係叫全球推動啦，就係、是、你每一個地係試行每一個地區去做一個選擇咁樣。So Professor Zisis, I'd like to know that. So would you comment? Will you kind of suggest anything that any model that Macau should follow? Because now actually on one hand that we still have very strict border control, so we are safe now here, okay. But on the other hand, so I think that we start to kind of welcoming tourists from mainland China, but at the same time we encourage locally that people to take the vaccine as well. But if I look at the figure, I can kind of update you that in the past like 2 months, we have less than 10% of people here willing to take the vaccine, and that they have the 2 doses already. And so I think that I don't know what we see the speed, the pace. Is it kind of slow? I think comparing to countries like Israel or US, we're not doing very quick. But at the same time, I think that because people feel safe here, and so because we have no cases for a long time, so people do not feel the need.
But we already purchased the vaccines, and some of these vaccines will have a very limited shelf life.
Yeah, it will be expired very soon. So, and any comment about this? So what would you suggest us to do?
I would still say our experiences internationally is that the vaccination works. And the reason why we still put a lot of emphasis in the vaccination is because we see new variants emerge for this virus, and these new variants, some of them have much higher transmissibility, which means you don't need a lot of introductions in the community for an outbreak to start. So we still think increasing the rate of vaccination in the population altogether is the best solution, both in terms of the financial one, because you don't need high degrees of hospitalization later on, but also in terms of the social one, because the people know that you've taken care of them, that they have been provided with a solution, and then they feel more comfortable, happier that this has been done. So I would say the first priority would always be on the vaccination at the moment, because this disease is developing. It's really very active. In terms of the rollout of the vaccine, I don't think comparing to Israel is a good comparison necessarily, because Israel did something that is very unusual. So they included the whole country as a clinical trial on the last phase of the rollout. So this is not a typical way of vaccine administration. I think in some ways it's better to have a steady pace, because it means if you have some adverse reactions, which we haven't seen at the moment, but just in case, you're able to detect them and you're able to respond and inform the right authorities. So I would say slow and steady, but slow and steady all the way to the end, not just halfway.
咁佢都講咧，而家喺國際上咧，其實疫苗咧，其實佢係有效嘅。咁點解佢要強調呢個疫苗係有效咧？其實因為我諗佢係有2個層面去分析啦。即係一個就係喺個經濟上，因為疫苗嗰個成本咧，其實係低過你入醫院，因為要醫一個肺炎咧，其實係要花上好多人力物力嘅。咁同埋第二咧，同埋時間啦。咁同埋第二就係個社會上，即係佢 social 亦都講，就係啲人打咗佢係即係佢會安心啲嘅。就算對於做生意啊，或者大家出嚟見面啊乜嘢，大家會有一個安心啲咯。咁佢講我哋話接種率嘅問題，我哋其實就未必咁適合同以色列去比較，因為佢哋做嗰啲稍微有少少唔同嘅嘢，就係佢哋成個國家就係一個比較激進嘅，就係一個臨床測試，個個都去試咗，即係佢哋由頭到尾都係成個國家係做一個，即係有啲人其實可能係心理劑啊乜嘢咁，咁所以唔係應該同我哋嚟比較。
咁所以我覺得頭先即係 Professor Zisis講咗一點，即係我聽完都好安心嘅，就係因為之前都好多人 講話，澳門都接種得好慢啊，
係啊，
大陸比起上嚟都接種得慢啊，咁我哋就即係其實小 case 嘅地方，其實都接種得慢。咁但係頭先即係聽 Professor 咁講就即係以色列就即係好激進啦，成個國家都當係一個臨床測試咁去做，咁佢哋係應該強制我記得。咁但係我哋呢度雖然係慢，但係佢話即係慢咧都唔緊要嘅，只要係一個穩定嘅增長率咧就可以。係啦，
因為慢啦，但係慢有慢嘅好就係當我哋如果發現一啲好大嘅副作用或者好大嘅問題，咁我哋就可以即刻翻去轉頭睇。如果去得太快咧，可能啲嘢就會亂啦。
係啦，咁所以其實而家我哋就叫澳門慢慢，咁但係應該都係叫做係可接受，咁只不過係開放都要慢啲。
係啊，即係一步一步，我哋大家都係去到個終點就得啦，即係唔使一嚟就即刻上，好似開車開到最快咁嘅。
係啦，咁所以其實我都記得就係即係之前啲朋友問我啦，都話即係如果你好唔安心，咪唔好打住咯咁樣。咁但係如果你信嘅，你身體冇咩特別都可以去打。咁就係我哋叫 slowly and steady 咁樣，即係都係一個好嘅方向咁樣。咁好啦，咁我哋繼續問 Professor 即係如果我哋話即係緩慢都係好啦，咁其實慢又會有幾慢咧咁樣？因為其實我哋而家都講緊係成個疫情就持續咗1年啦咁樣，咁即係跟住落嚟會係點咧咁樣？咁so Professor we were just talking about that. Thank you for your kind of I think from your comment like okay even that we are getting people to get vaccines slowly but steady is still the way. So but what would you expect the end of the pandemic? I can guess you must have a lot of discussion, among specialists and experts in the world, internationally. So I remember last year at this time, even in Macau, we were all kind of thinking that okay, the pandemic will be gone very soon. Okay, maybe by the end of last year, or the worst would be early this year. I know that you've been working, in the Middle East for the MERS case and also the Ebola, and so. Can you kind of combine your previous experience to tell us what's your view about this pandemic now? And so would there be an end, or would it be, some other specialists? I read articles suggesting that we won't be able to see God. It might become some kind of flu, surrounding us in the future. So do you have any, insight? Okay, or what's
or maybe a professional professional epidemiological comment. Yes.
It's very difficult to predict. It really is very difficult to predict because of the scale of the infection throughout the world. Normally, when we have outbreaks, you would see them in one country or in one region, and it's much easier to predict what's going to happen next. Here, because we see a lot of different areas in the world, but also different areas infected at different rates. It's very difficult to predict what's going to be the day after. But what we can say from previous experiences, like with Ebola, as you mentioned, is that it doesn't go away immediately. So you manage to control most of it, and then you would still see some sporadic outbreaks here and there for a period of time. So our advice, the same as it was before, is the public health component needs to be strengthened. And it's not just a case of surveillance, it's the public health infrastructure needs to be strengthened. And we understand that a lot of times people, there is hesitation because strengthening public health infrastructure is an expensive proposition sometimes. But given the amount of time that we would need to be monitoring the situation, given the amount of time that we have more and more of these outbreaks happening in different parts of the world, and that we're connected to this world, I think that is the best solution moving forward. That we need to have not just the surveillance system, but the research capacity developed, to have some sort of archive, some sort of biobank developed, so that and all these components to be able to communicate to each other and be overseen by the authorities, so that if something happens, the mechanism is there and it's ready to respond quickly, much quicker than it did before. So we don't expect this to go away quickly. It will go away. Whether it will be turning something like the flu or not, it's too early to say.
So would it be? I just want to chime in a bit. Like I think like last November, when the cases kind of dropping in most part of the world, we were kind of expecting that was the day that it's going to die down very soon. But now recently we know that with the cases in India, increased like crazily. So it seems that so we call it the third wave. So in your world, would that be like there would be still the third wave and fourth wave, 5 waves until certain, and then it will still kind of we still need, we didn't reach the, I don't know how to say, the peak yet, right? Or if every country they're taking a more radical measurement for time, and like what we did in China last year, I think at this point, so they locked down the whole city for like 1 month, more than 1 month, and then once that kind of situations we're able to control, and then it will die down. So until all those kind of waves gone, and so the whole cases will.
But the example of China is really a very successful one, because it managed to control very quickly, and because China has a very large population density, it could have been a lot worse than it was. So at the end, it was a very successful response. But China and a lot of countries are very collective communities, so they come together and face the common challenge. But we have a lot of other communities in the world that they cannot do this. And see that there is a problem on implementing those measures in other places because it's very foreign for them.
係啱啱都講到，其實話而家個疫情其實係非常之難去預測嘅，因為如果譬如你話有只係得幾個地區由 A 去到 B 咁，我哋都因為嗰個感染率都仲計到，但係而家係好多方面嘅疫情，所以非常之難去預計嘅。但係佢所以咧，起碼對於我哋嚟講咧，我哋要加強我哋嘅啱啱講過，除咗監測之外，其實我哋要去 upgrade 我哋嘅公共衛生嘅基建啊。咁佢講其實可能好多觀眾都唔知公共衛生基建係咩，即係公共衛生基建好似一個城市嘅機場咁。咁其實好似啱啱佢講咧，就係一啲生物嘅樣本庫啦，咁佢可以提高我哋一啲研究嘅水平啦、監控嘅水平啦。咁雖然係永遠好多時候政府都會佢會有少少 hesitation， 即係有少少猶豫嘅，因為其實呢啲基建都係投入好大嘅資金，即係好似你起一個機場咁，都係一個好大嘅投入，同埋要計劃得好好嘅。但係其實你長遠嚟講咧，如果你建立好啲基建咧，你每次當你有呢啲疫情嘅時候咧，你係可以用同一個機制去 response 去反應過嚟咯。咁長遠嚟講咧，係會令到我哋嗰個公衛嗰個防禦能力係提高嘅。咁你啱啱講到話，好似其他國家咧點解好似我哋個個都以為11月就完咗啦？係啦，此起彼伏，跟住呢度即係歐洲靜咗，跟住美國繼續，跟美國靜咗，跟住而家就做。因為中國其實係一個比較稀有、比較成功嘅例子嚟嘅。咁但係其實咧，中國而家雖然過去伊波拉啊或者其他嘅經驗咧，其實就係當一個疫情好似消失咗咁，其實佢唔會消失，佢之後仲會有少少零星嘅個案，因為呢個係同佢個流行病或者個病毒嗰個行為其實係有關嘅，比較專業少少嘅。咁其實我哋喺大陸都見到㗎，我哋控制咗，但係點解我哋都有零星嘅？久唔久都有本土係啦。咁其實全球都係嘅。咁大陸而家咧其實佢係 OK， 佢而家算係清咗零。咁但係其實側邊嘅國家亦都經歷緊呢樣嘢，有啲守唔住咁，好似印度咁爆咗。咁但係其實 大陸我哋好多鄰居㗎嘛，咁其實我哋都係黐埋一齊嘅，咁其實大家都係面對緊同樣嘅風險同挑戰咯，咁所以佢話所以喺其他國家亦都有好難去 follow 到大陸做嘅嘢，因為每個地方都有佢個難度咯，咁所以佢話中國係一個非常之少有成功例子，你話所以你話幾時完咧？其實呢個真係非常非常之難去預測到，因為個變數實在太大啦。係
啦，咁即係可能我哋而家講緊就係啦，我哋梗係想有專家就可以答下我哋幾時完啦。咁但係其實而家專家都講緊咧，就即係其實我哋都未知嘅咁樣，但係都可以睇下係咪即係咪打疫苗打到咁上下，有個群體免疫，佢都係有啲機會咧。咁我哋再問下部分事實先。So we know that it's hard to predict, but of course, as a layman, we always want to hear good news from the experts, and so if we can't really predict now, and then we know that it's we just don't know. Maybe there would be still other waves. But if the percentage of people that are taking the vaccine would increase even steadily, and so would that be a day that we really reach the herd immunity situation? Okay, with 70% of population in the whole world, they have vaccine already, and so would that kind of
bring a hope,
bring a hope and bring us to the status that we know that it's going to die down very soon. Would that be happen?
Yes.
Yes, that would be.
You can see that.
There is still a case,
yeah. Yes. You can see that from the cases of Israel, of the United Kingdom, where vaccination has been. When it started reaching 50% of the population, you could see the hospitalization rate was going down, and it wasn't just going down gradually. It just gave a big dive all the way to the bottom. And when it reached 70%, 80% of the population, you still got 1 or 2 cases, but they were very few, and most of them didn't even need to go to the hospital. So that's why we insist on the vaccine, because we know it works. And we cannot predict the future, but at least we can predict what we can do for ourselves, for our communities. So if we increase the vaccination rate at the 50% mark, we should start seeing significant impact. At the 70% mark, we can start saying, yes, okay, we're able to control it, we're on top of it, and we'll control it all the way to the end.
Okay, but just want to ask one follow-up question, is that when we're talking about 50% or 70%, we're not talking about the whole Earth, the whole Earth as a whole, right? So we're talking about that each country should reach that rate, right? 50 or 70% rate. And so, but then in that case, well, now we know that the third world, they don't have enough vaccines, so their vaccination rate is still kind of low. So would there be other way that we can help, any way that even like I think WHO is also helping? And so I think if we cannot wait until even the third world, they're taking the vaccine, and so then we can't reach, the hope status that we were talking about, right?
Yes, and in some ways it is inevitable. All of the vaccination projects that happened in the past, they reached that level at different times for different countries. For example, the polio vaccination, it reached Europe very, very early on. It reached the rest of the world later on, but there are still some countries that are very difficult to complete. The World Health Organization has a framework. They have a system to address this disparity. Right from the beginning, because we had this experience, we said, this is going to happen. This is going to be a problem. We need to start thinking about it. And actually, compared to previous campaigns, we started thinking about it a lot earlier than before. And we're a lot more effective than before. We're not perfect, but it's still more effective than before. In some ways, it's inevitable that we'll have to create some safe bubbles. So for areas that have reached that herd immunity level, we allow them to start opening up, and that acts as motivation for everybody else to reach that level and join into those bubbles. If we wait for everybody to immunize at the 70% level, I think that would be the ideal scenario, but the practicality of it is rather different on the ground. So the next best thing is to at least allow the freedom of travel, the freedom of returning back into normal as much as possible to the communities that have reached that goal, and support all the others to reach it as quickly as possible.
所以啱啱佢就話點解佢哋仍然好堅持咧推行呢個疫苗計劃咧？因為其實我哋知道 work 嘅，咁就回答咗你啱啱講群體免疫呢樣嘢啦。咁當然啦，因為我哋喺其他國家咧，譬如以色列咧、英國，你睇到咧接種率去到50% 嘅時候咧，成個入院率咧已經跌，而且嗰種跌唔係慢慢跌，係跌得好犀利。咁70%咧已經係有一個好大嘅改變啦，因為其實基本上啲人只會病下，唔會入醫院，咁基本上係翻去正常嘅。咁所以佢話佢哋點解世衛仍然係咁堅持推行呢樣嘢咯？係啊，咁你話啱啱講到咧個問題就係如果我哋當然啦，係個最理想就係哇全世界打晒啦，係啊。咁但係現實上其實我哋有困難，因為疫苗又唔足夠啦，有啲國家資源又唔足啦。咁所以咧個趨勢係咧肯定係會有啲所謂嘅安全氣泡啦，係啦。咁就希望可以盡量恢復翻幾多正常就得幾多正常咯啊。
所以其實可能都會係一個我哋叫即係發達少少或者富裕少少嘅地方，佢哋就打得咁上下，咁就先連結咗先。咁跟住就第三世界國家，我諗我哋都要幫啦。所以其實我之前我都講話，喂，其實澳門如果我哋打得慢啲，係咪就訂慢啲咧？即係慢慢到貨咧？
因為啱啱可能補充翻少少就係，其實世衛咧佢哋都有推行過全球疫苗嘅，係啦。咁 polio 不過唔知道中文係
疫苗保障計劃，
即係唔係即係嗰個病毒，即係佢嗰種疫苗叫 polio。我可能只係話翻俾你，我唔記得佢係咩。咁其實佢哋都係推行喺全球推行過。咁所以呢樣嘢亦都唔係對世衛嚟講唔係一樣新嘅嘢嘅。其實咧喺而家嘅框架入邊咧，其實係比以前更加早知道會發生咩事添。佢哋知道疫苗將會浪費嘅，佢哋知道嘅，佢哋亦都知道呢啲疫苗去第三世界有咩問題，係啊。咁所以對於佢哋呢啲嘢唔係一個新鮮嘅事物嚟㗎咯，係啊。佢哋亦都會知道究竟譬如第三世界佢哋將會面臨有咩問題，所以佢哋先會諗到呢個旅遊氣泡係一個趨勢嚟，大勢所趨嚟㗎。因為有啲國家事實上佢哋會有少少困難。
咁所以其實即係對澳門嚟講咧，下一步咁如果我哋即係而家接種率都仲係低啦，咁我哋可能好快去即係10咁上下啦。咁但係即係我哋之後要同人哋開放咧，可能我哋有一樣都係要有多少少接種。咁或者其實咧，我哋喺度等得唔得嘅？因為有啲朋友話：喂，得唔得？我哋唔接。就等其他人打晒，咁樣我哋撈勻。我點解頭先要問佢係咪全球去計咧？就係因為有啲朋友話得唔得撈勻計咧？澳門佔人口比例咁低，其他人打晒，我哋咪唔使打就得到呢個群體免疫，得唔得㗎？
咁所以我相信
頭先佢都係講緊一個。
其實好多呢啲嘢都係要一個即係同人傾咧，有一個對等，因為你去人哋都要去翻你嗰度㗎嘛。咁所以我諗咧咁就其實我哋個人口咁細咧，去到50%相對咧比其他地方其實係容易少少。我諗可能喺政府上邊可能做多少少推廣，因為我諗我哋可能受好多唔同傳媒嘅影響啊，咁所以我哋得唔到一個好正確嘅信息。大家將個焦點放咗可能100萬人入邊，只有2個人發生一個即係可能疑似副作用，係啊。咁但係我諗我哋同時間睇咁多副作用嘅嘢，我哋都睇翻其實佢帶嚟嘅正面嘅效應咯。
所以其實即係可能即係專家就好似即係同我哋醫生講一樣啦，即係始終打支針咧就好啲嘅咁樣。咁好啦，咁我哋即係最後睇下Professor Zisis 咁再有啲咩 suggestion 俾我哋。So Professor Zisis, thank you much for your input today. So our last question would be, are you expecting to visit Macau soon?
He would love to.
Yeah.
hope so. I really hope so.
So in what situation you think that people like you can visit Macau again? So if you can come back, would that be the day that we have the herd immunity already, or we just have the bubble?
I hope that it's very soon, and it's the day that we have herd immunity, and not just us, but the whole population is protected. But you know, I have to say, really, when I say we need to congratulate the public health, all the healthcare officials, I really mean it. It's been the first time ever in history where we have a new disease, and we managed to control it within a year, and we managed to have a vaccine within a year, and now we're talking of vaccinating the entire population within a year. This has never happened before. So in some ways it's good to say, yes, we have some challenges to make it fair and equitable for everybody and bring everybody to the same level. But I think the message that needs to come out, at least from my side, is always a very positive one, because we've had a very serious threat to the whole of our society, and within a year, in a very scientifically led way, we managed to find solutions, and we will manage to move forward. In my view, the more we keep the lockdown and measures that stop us from having a normal life, the more we create side effects that are unintended. You know, we have, say, cancer patients that don't get the treatments regularly, or people that cannot travel for work, so their living situation is pressed. So I would like to say, yes, it's a very positive message altogether. We managed to do more than ever before in the shortest amount of time.
Okay, so
係啊，咁佢就話其實佢都佢希望好快嚟到啦，而且係再嚟澳門啦，咁同埋係好希望係一個群體免疫下嘅，係因為咁即係代表咧，我哋就會更加快去即係走出呢個疫情咯。咁但係佢都話其實我哋喺人類歷史上，其實我哋第一次咧咁短時間內去應對一個完全唔知道陌生嘅病毒，咁短時間內我哋開發咗一個疫苗，咁短時間內我哋揾到一個方法去控制。係啊，因為其實咧喺歐洲嗰邊咧，佢哋而家仍然係 lockdown 緊㗎，好多人係受緊呢個病毒嘅影響㗎，所以其實對於佢嚟講，佢對於我哋大部分嘅 comment 咧都係好正面嘅，因為大家始終個對比係有一個好大嘅對比咯。係
啊，咁即係我諗即係成件事就我哋話有一個疫情，咁大家都知道唔好啦，即係我哋都好多即係喪失咗好多生命啦，咁好多人即係健康受影響，生活經濟都受影響，但係好似即係Prof咁講啦，就但係如果用人類歷史咁樣嘅眼光去睇啦，咁的而且確我哋就叫好短時間裏面就有好多即係科技醫學，即係頭先佢講公共衛生裏面嘅一啲進步，我哋都係見到。咁或者我哋就先同Prof就講拜拜先，咁我哋等間就翻到嚟，我就會同阿 Jackie 繼續講多少少，即係跟住我哋澳門係即係點樣可以再做好啲咧咁樣。OK， 好啦，咁我哋翻嚟就同 Prof傾完啦，咁就即係我哋呢邊都再引申再傾一傾啦。咁因為澳門就大家都知道個疫情，但冇諗過延續到而家，但係而家都已經係啦。咁我都睇到咧，其實即係啱啱呢兩日咧，香港政府林鄭月娥佢都有即係特首有講話都會除咗之前佢同新加坡傾嗰個旅遊氣泡，咁亦都話諗住都要同澳門傾嘅。咁我見咧網上面咧，即係起碼我自己嘅 page 嗰度咧，嗰啲人都幾負評啊，即係好擔心就係即係話人開嗰個氣泡，我哋就會再嚟。咁我諗呢個都可以即係結合埋我哋今日想講嗰件事咧，就係話即係究竟而家嗰個疫情嘅情況底下，我哋究竟仲要點咧？咁如果頭先聽即係世衛專家講咧，最重要都係佢哋就總之都係vaccine係咪？即係疫苗咧，始終都係嗰條路嚟咁樣，疫苗先係正路。咁我哋就澳門呢邊咧，因為我之前聽得比較多朋友講，我頭先都有講過，就係其實諗過我哋即係人口基數咁細，係咪可以等人哋都打咗先最後先到我哋咧咁樣？咁但係即係聽你咁講就話，喂， 哇！咁如果係咁，我哋可能氣泡都開唔到。咁其實而家跟住落嚟，我哋都係講緊一個平衡啊，就係我哋點樣喺即係守住個關，唔可以好容易有好大量嘅即係我哋話輸入性嘅 case 入咗嚟，跟住變社區。即係點樣喺呢個情況底下，我哋慢慢可以鬆動翻少少咧？咁或者即係如果我哋都要同全球去，我哋或者唔係同步開放啊，即係我哋要慢慢有啲地方開翻的話，仲要做啲乜嘢咧？
我啱啱可能補充翻少少，佢都話點解除咗用個疫苗之外咧，其實我哋有啲新嘅變種病毒咧，佢唔需要好多 case 咧，因為佢個傳染力好強啊，咁所以佢就話我哋點解一定要打咗疫苗先，即係好驚呢啲變種病毒入咗嚟。如果我哋自己個接種率又唔高嘅話，我哋又爆多次，咁就會好麻煩咯。咁你話慢慢如果我哋要慢慢開翻關，其實我諗第一樣嘢就係我哋要有足夠嘅科學證據，去令到我哋係安全嘅，我哋唔需要去令到我哋嘅醫院有負擔，又或者好似重蹈覆轍印度發生嘅情況。咁現時我諗最好嘅科學證據就係都係打疫苗咯，係啦，呢個係唯一嘅出路嚟嘅，係恢復翻成個社會嘅秩序咯。
即係因為我哋睇咗咁多地方，就包括頭先 Professor Zisis 咁講啦。咁譬如印度其實之前都冇咁嚴重，即係舊年曾經我哋叫即係中國之後，佢都係其中一個嚴重嘅地方，跟住就好咗好多。咁而家就爆出嚟，就係主要係個變種嗰個問題。咁如果頭先講翻好似英國咁樣打到50%之後咧，其實係大幅度嗰個入院率係跌嘅話，咁始終就我哋呢邊都係要行疫苗。但係其實我都好多朋友好驚個疫苗。
我諗係我哋將個焦點過分放咗喺個副作用嗰度咯。其實你就算食必理痛都係會有一定嘅人係對佢過敏啊乜嘢嘅。咁其實我諗而家我哋叫做有得揀啊。咁有得揀嘅時候，所以啲人咧就更加去學多啲呢啲疫苗嘅知識。咁但係一講到話副作用嘅話咧，大家聽到個字都好似好驚咁咯。其實好多時候對於疫苗過敏，其實你由細到大你都係睇翻個針簿，你打咗好多支針㗎啦。其實咁你大概你會知道，如果我對呢樣嘢過敏，其實我應該係知嘅。點解好似咁多老人家有反應？因為佢哋以前嗰個年代咧冇咁好 record，咁可能有啲唔齊啦，可能有啲係大陸落嚟啦，咁佢唔知道，佢好多都冇打，即係好似我有屋企人咧，佢其實原來冇肝炎嘅抗體嘅，咁係啊，原來佢 miss 咗一支，因為大家個 background 實比較複雜，咁但係大部分年輕人咧，我哋出世嘅年代都係有打。唔係
80後嘅時候應該都比較安全，咁所以其實即係如果係咁講嘅話咧，我諗即係跟住落嚟，如果聽翻晒，即係我哋叫唔同嘅專家講，有一啲叫平衡啲嘅方案咧，咁都係一方面就我哋喺個社區個預警啦，同埋我諗我哋入境嗰個防控嗰度就應該都已經係好好噶啦。咁但係就係社區啦，頭先講緊成個社區個防控啦。咁另外就係一路繼續鼓勵，起碼唔驚嘅朋友打疫苗啦，咁做多少少宣傳嗰個工作。咁你頭先你講到一個嗰個健康嗰個基建啦，嗰個都重要咯。可唔可以講多少少？
係啊，其實健康基建咧我哋好似一個城市咁，會有火車站啦，有機場。咁其實咧，健康嘅基建咧，我哋講緊係一個叫做生物嘅樣本庫咯。咁樣本庫咧，其實就將一啲唔同嘅臨床樣本咧儲存咗，好有秩序咁儲存咗嘅。咁儲存咗之後咧，咁你其實將佢歸類啦，呢類人群啊，譬如佢係有癌症，呢類人群佢係有感冒咁即係流感啦，我要專業少講。咁當你想去研究某啲人群嘅時候，你就可以喺呢個樣本去就分好晒啲數據，好短時間內產生到一啲數據。咁例如我哋譬如一個社區，譬如黑手環咁，去定時都去一個診所嘅社區中心，咁我哋攞咗佢啲樣本儲住咗。咁而家突然間有異樣喎，咁我咪可以即刻 screen 到呢紮人。佢究竟有幾多人有呢個病毒咧？咁我可以就即刻好精準知道我知道住喺邊啦。咁我即刻可以落實到一啲措施。
但係呢個會唔會有私隱問題啊？
有嘅。咁其實咧樣本庫呢樣嘢咧已經有咗成20年都有起步咗。咁其實好多國家咧都有唔同嘅法規咯。咁其實係非常之健全㗎啦。因為其實我哋銀行嘅卡啊，個嘢都涉及到私隱。咁未來嘅趨勢，其實喺個時代雜誌咧09年已經講咗樣本庫係會 令到人類生活會改變。我哋未來10年就係因為樣本庫要改變我哋。咁其實有一個我諗可能好少人知道咧，就係有好多人咪打流感疫苗，唔知佢 work 唔 work 嘅。其實我哋好多外國譬如英國都係嘅，我哋會攞翻啲人去社區去當佢病嘅時候，我哋睇翻佢哋個樣本就係究竟佢個疫苗有冇打疫苗啦，有幾有效啦，我哋就靠樣本庫去評估咯。咁每年英國政府就會有個流感嘅報告嘅，咁全部嘅數據都係喺樣本庫出現。
所以其實即係講話下一波講緊要疫情再快速啲去應變啦，即係包括而家講緊變種嗰個新冠肺炎病毒都好啦。即係如果有呢一類即係樣本庫咁樣健康基建咧，其實都係會叫做
佢有一個好穩定嘅機制啊！即係我去睇翻啲樣本我就知道究竟個社區係發生緊咩事。咁同埋對於我哋澳門嚟講咧，當我哋有呢啲樣本嘅話咧，對我哋科研事業咧，亦都係有幫助。所以我哋話點解佢係一個基建咧？咁你做醫療研究同埋做任何嘅公共衛生咧，你都係需要樣本噶嘛。咁我哋將佢有秩序、好有標準咁儲存起嚟好重要。但係樣本庫係一個好貴嘅投資咯。而家到現時為止咧，冇一個樣本庫可以話到俾你聽，佢可以賺錢嘅，或者佢做到收支平衡已經係非常之難，但係喺我哋即係喺大陸咧，佢係做得好成熟㗎啦，已經係啊，即係好多最近喺深圳有一個全球第2大樣本庫。
OK， 好，咁好啊，咁亦都希望即係當局可以考慮一下呢個工作。咁我哋就抗疫成個來之不易做得好，咁但係下一步我哋都係要諗下點樣可以叫做逐步啦，慢慢緩慢咁打疫苗，穩定增長之後咧，就諗下一啲我哋叫做逐步開放嘅方案嘅。咁好啊，咁今日再次多謝晒 Jackie， 今日亦都多謝咧已經下咗線嘅 Professor Zisis， 咁多謝晒大家收睇，多謝晒，拜拜。
拜拜。